Good afternoon, and thank you for joining us today. My name is Jessica Steger, and I'm the Executive Director of Clinic Operations for UnityPoint Health Finley Hospital. Today, and over the next several minutes, I will be talking about men's health with Dr. Kenneth Martin from UnityPoint Clinic Family Medicine in Dubuque. So welcome, Dr. Martin, and thank you for joining me today. Can you give me a little bit of introduction about yourself and a little bit of background?
I've been with UnityPoint Clinic for 2 years. Grew up in Los Angeles, California, did most of my schooling down there, went to Northern California for undergraduate, Southern California for medical school. By the time I was about halfway through, I started having kids, so decided to have a change up. So we moved to the Quad Cities where I did residency at Trinity in Bettendorf. The family and I loved Iowa, loved the UnityPoint Health system, so we started looking around locally, found Finley, and here we are.
So you're a busy dad. You have how many kids?
I have 4 children.
4 children. So you being a busy dad, you're a male. Can you maybe give us some information on why men may be reluctant to visit a primary care provider or come in for regular checkups versus just going to the doctor when they feel ill?
Well, most men, when I speak to them, I usually ask the question since they aren't really in the top demographic to go get regular health care. And from what they tell me, it's one, they feel fine, so they don't really need anybody to tell them that they're healthy. Number 2, some of them, they do have strong family histories of certain conditions, and so they're kind of apprehensive of being diagnosed with anything that would kind of turn into something bad later. So pretty much if I don't see it, it's not there.
Yep.
And the third reason is because they don't have time. Family medicine clinics are usually, business hours 8 to 5. Most people, guys work full-time jobs longer than 8 to 5, so they don't really have time to fit it in.
Yep. And those are definitely some good reasons why they want to avoid seeing a healthcare professional or establishing care. But what are some reasons that you can state to men on why do they really need to make their health a priority?
Well, the biggest reason that I try to get over to them when I see them in clinic is that a lot of the conditions that lead to bad outcomes, such as heart attack, stroke, and things of that nature, don't really have symptoms while they're ongoing. Yeah. So I try to talk to them about the usual screening things based on how old they are. So blood pressure, because you won't necessarily feel that your blood pressure is running high, and it can be causing a lot of damage to the small vessels in the eyes, kidneys, brain. Diabetes is usually asymptomatic before it's full blown, and cholesterol too, it can be high and not really cause any symptoms. So even though you feel well, I try to let them know that these are things that need to be at least screened on a regular basis.
Yep. And you work in our urgent care as well, Dr. Martin. So when you see some of those patients that come in, especially, like I said, males, they come in and they're just acutely ill. What is usually your suggestion to them if they don't have a primary care provider? Are you providing information and education to males during those appointments as well, just on the importance of establishing with the primary care provider?
Yeah, that's something I try to do. I know that we have all of our clinics, but usually when I see a patient and they don't have anybody, since I'm already kind of familiar with them, they're familiar with me, and I kind of laid the groundwork, I try to get them in to our clinic. So, because that's one of the barriers. The guys don't really like talking to strangers about these sensitive issues, and so once they already put a face to it, it's a little easier to kind of get them on board.
And establish. Yep, no, I definitely would agree. Why is it important, do you believe, for males to have a primary care provider from a relationship perspective?
Well, pretty much like I said before, it's hard for people to kind of come out and express some of their fears, some of the conditions in their family. It's not something that's easy to talk to. So, just having a primary care doctor on board, they feel that they have that relationship, and so they have somebody to go talk to when they have those concerns and to kind of lead them along the right path to health.
And I also think it's good when they do establish with that primary care provider, when they do continuously see that same face over and over again, whether it's for their physicals or they do get sick, it is good to have that someone they feel comfortable with. It wants to make them come in. It wants to get them to address a lot of those issues when they do feel comfortable with someone. So I definitely think that's a good point that you bring up. As far as healthy lifestyle for males, what are some simple ways that men can start increasing activity just to get themselves healthy? And it's nothing like they have to go out and join a gym or spend a lot of money. So what are some small, simple things men can start to do?
Some of the easier things that they can do, because when they have the time crunch, they say they can't fit it in their schedule. So I try to incorporate activities that can be built into the schedule. So things like just setting a step goal 7 to 10,000 steps per day.
Yep.
Mostly everyone has a smartphone or a watch that can keep track of that. And kind of setting that goal, it keeps them accountable because they can see, okay, I'm here. Do I need to walk on my break, or do I need to have a walking lunch in order to get that in there?
Yeah, I think that's a good idea, especially while you're working, just to get out, get some fresh air, go for small brisk walks. Any little thing helps, and even joining a gym. If you do have a gym that's close, we do have a lot of options in the Dubuque area that are very reasonably priced, and really it helps for your mental and overall state too, just to get out there and exercise. And same with the kids. If men do have kids, what are some activities they can get involved in with their kids? You know, if their kids are in sports, they can help them practice at night, or play baseball, play football. So not just standing there watching and coaching, but really getting involved.
Yeah, that's another thing that they don't really realize is, I mean, the coaches usually appreciate having the extra help, so you can get out there and kick the ball with them. They usually need wranglers for the other children, so you can run laps with them, kick the ball back and forth.
Yeah.
And get involved rather than sitting on the sideline and kind of wasting the opportunity to get a little exercise.
And I think too, if your kids are watching you live a healthier lifestyle, your kids want to follow that as well. So
Definitely.
Kind of a positive on both ways. What is typically the goal that males should really strive to in general, maybe a daily goal that they should strive to for exercise?
Typically, we recommend about 30 minutes of aerobic exercise. So you want to get your heart rate up to about 70% of its maximum. For most people, that means breaking a little sweat.
Yep.
So a leisurely stroll where you can walk for 300 miles isn't really cutting it, but something where after a while you'll eventually get winded. You want to get at least...
You're getting a little short of breath, and you're exerting yourself a little bit. Now, as far as I know, we've talked a lot about exercise. What about with diet? What are some things that men can use as a guideline just to have that healthy diet, healthy, balanced meal plan?
Well, in terms of diet, I mean, there are two things that I usually talk to people about. One is total calories. You want to make sure that you're burning more than you take in, so you don't put on unnecessary weight and kind of keep that optimal, but you also want to look at the quality of the calories. Starting at the top, you want pretty much mostly protein.
Yep.
You can have fats in the middle, and you want to limit yourself to about 10% of the total calories with carbohydrates, because basically carbs are the fuel for your muscles. You use what you use, and the rest gets stored in fat.
Sure.
So I mean, you have too much of that, then you're just putting excess fuel in the tank.
Okay.
Don't really need it.
Same with, spacing of meals. Do you recommend skipping meals, or as far as meals throughout the day, should they be eating 3 meals, large meals, small meals? What do you typically recommend in that regard?
Yeah, definitely not skipping. Ideally, you want to keep the furnace burning. So usually you want to have breakfast, a lunch, and a dinner, kind of following those guidelines, and then also have a couple small snacks in between.
Yep, good thought. And meal prep is probably a good habit to get into. If they're prepping for their meals, they're more apt to pack their lunches or to go for the food that they've packed, versus if they don't have anything with them, it's easier to go out or grab something maybe more unhealthy along the way for the day too. So any other advice for males that you can think of that you'd like to give our viewers?
Just be proactive about your health. It's something that is easy to kind of get behind the 8 ball just because you're feeling well. I usually tell newer patients or ones who are kind of reluctant about the few that I've had that ended up diagnosed with some of those bad things like diabetes,
Sure.
After a heart attack or after an amputation or after a stroke. So, I just try to really stress the importance that, you feel fine, but these are things that you kind of need to check.
Yep. These are what we want you to avoid, and by doing that, by establishing with somebody like a primary care provider, we can do a lot of those screenings up front and assessments to help avoid some of these long-term complications. So thank you, Dr. Martin, and happy Father's Day to you this coming weekend, and happy Father's Day to all you dads out there as well. And thank you for joining us today.